Hi, I'm Loudon Wright. I am the Associate Veterinarian here at the Nashville Zoo. And I'm going to tell you a little bit about the procedure that we did on Pinocchio, our Andean bear. And we did a root canal on him because he had broken a tooth and had developed an infection up under the gum line. So the keepers first noticed that Pinocchio was drooling a lot when he was eating, especially when he was eating harder foods. They noticed that he was kind of rolling the biscuits and some of the harder produce back and forth in his mouth, and that he was avoiding chewing on one side. And we did a full exam on him, so a head to tail exam, took whole body x-rays, took skull x-rays, took blood for blood work. What we found was a broken maxillary canine. So it was one of the big canine teeth up on his upper jaw had been fractured and had exposed the nerves and blood supply that kind of flows into that tooth. So we contacted a veterinary dentist, Dr. Keith Stein, to come out and perform root canal therapy to try and save that tooth. So root canal therapy is where a veterinary dentist or a human dentist would go in and basically clean out the infection in the tooth without removing the tooth. He was able to go in with a file and basically scrape out and remove the infected tissue and remove the infection. He then flushed out the area to remove any residual infection, and then to preserve the tooth, they go in and they fill it with a bonding agent and an acrylic that will allow the tooth to stay in place and prevent any further infection from getting down in there. After the procedure, Pinocchio woke up really well. He recovered really well from anesthesia. For the first 2 weeks after we've done that root canal, we don't want him to have any really hard foods because we want to have that root canal have a chance to set. So Andean bears are omnivores, meaning they eat a wide variety of things. They've got a really varied diet. They do get a meat component to their diet, but they also get a lot of fruits and vegetables. In about 4 to 5 months, we'll probably perform another procedure on Pinocchio, and we'll go in and we'll take x-rays just to make doubly sure that he's not developing a new infection underneath that root canal.